No problem.
Can I have you, I'm gonna run back to where I record. Can I have you just say like test
Sure.
a few times in
Absolutely.
about 30 seconds?
Okay.
Okay.
Hi, how are
Hello,
you doing?
Commissioner. Good. How are you?
Good.
So the food is very, very similar, but
Where's Buddy's?
it was on 10th Street where the taco shop is now. It was Buddy's Hamburgers.
The Mencers
for-
on that too? Huh. I don't remember Buddy's.
Buddy's was good.
It was there.
Remember it.
When I went to Topeka High, we'd go there for lunch all the time.
Yeah. I don't remember Buddy's.
Okay.
It's where, you know where the Mexican taco shop is?
Yeah, that's what he said.
10th and College.
Yeah.
But it was sort of you were either Buddies or Bobo's back
Bobo's.
then. Because they were just right up the street from
Yeah.
one another.
Yeah.
Buddy's had still one complete parking lot.
Okay.
Ready? Ready. It's July 6th. It's a little after 1 o'clock. We're ready for the budget presentation for the Shawnee County Health Department. I'll turn it over to you.
Okay, good afternoon, Commissioners. My name is Theresa Fisher, Director with the Health Department. The budget presentation you'll be hearing today is from me and also Edith Gaines, our Finance Officer. So the budget was prepared by our leadership team, anticipating our needs and our strategic plan, which we'll discuss here in a little bit. This is our vision and our mission statement. These have not changed. Most of leadership that's here with me today played a large role in writing these, and so we still feel like these really embody the work of the health department, and honestly don't anticipate a change anytime soon. So I will introduce the staff with me here today. I have my leadership team. So we do have Edith Gaines, our Finance Officer, and she's also over our Financial and Administrative Services, and I will share more about what each of these divisions does in a little bit. We have Craig Barnes, who is over our Community Health Outreach and Planning Division, commonly referred to as CHOP. We have Derek Flerlog, who is our Infectious Disease Division Manager, and Carrie Deltz, our Clinical Services Division Manager. So this is our organizational chart at a really high level. This doesn't look too different than past years. The one thing I would draw attention to is there is one new box up there this year, our Infectious Disease Division, which is Derek's division. This was essentially born out of last year and the pandemic and our needs of what we had there. So that is the new area, and I'll talk about that here in just a little bit more depth. I'll start with our Financial and Administrative Division. I'll just give a brief overview of our divisions. So this is both our finance and our admin area. This is the area where you'll obviously see us working on our budgets, our purchasing, our quality improvement comes out of this area. Edith serves as our accreditation coordinator, which we're still working on. And then our electronic health records is also housed in here, of which we have been using now for just under 2 years. Family Health Division, this is my past division, and so I would note this is still a vacant position right now. This is a large division, so you'll see by the number of FTEs up there. The programs that are housed in here is our Nurse Family Partnership Program, which is our evidence-based home visitation program, our Women, Infants, and Children program, which has been in this division now for a couple of years, our First Steps, which is our master's level social work program, Baby Basics, which is our group prenatal classes. We did, I'm happy to say, get to do a couple of these virtually during the pandemic, and I'm even happier to say they're coming back in person this fall. And then our Fetal Infant Mortality Review Division, looking at fetal and infant deaths here in our community and how we can fill the gaps in our community to reduce that. Clinical Services, this is Carrie's division. This houses our STD clinic, our immunizations, our communicable disease. We're bringing back family planning. You guys have heard about this before, and of course our provider position is open right now. We did have that filled, and due to the pandemic, we were not able to keep that position filled, and so we're anxious to bring a provider on board and get that back up and running. I would be remiss to say that this group also hasn't played a key role over the past year with the pandemic and all the COVID work that's gone on. Our health protection, which also falls under Carrie's division, involves our environmental health and our child care licensing. So our environmental health is just that, anything to do with the environment. They do our septic licenses, they do our nuisance complaints. Currently they're doing our mosquito trapping. And then our child care licensing is our regulated program through KDHE. So they handle all the initial inspections, the annual inspections with our child care centers. That includes both centers and home daycares. And that includes all of Shawnee County, not just here in Topeka. They also handle any investigations for illegal child care. So a really important group of people here in our community for our kiddos. Infectious disease, this is our newest one. I want to draw attention, the 13.91 FTEs, that number does not necessarily follow the bodies. This division truly has 7 full-time staff members, but the FTEs follows the budget worksheet because we have so many different individuals that are doing COVID work. And so that's how we arrived at that number from the different divisions that pull in to help this right now. So this has been anything and everything COVID. So they're doing our isolation and quarantine orders. They're still doing our long-term care monitoring, our cluster management, if we've got any outbreaks, data, track all of our data involving COVID. And then they've also been the lead on our vaccine collaborative, which has been instrumental here in our community with our partners that have been able to provide the vaccines throughout our community. Our community health outreach and planning. This is, we have an epidemiologist in there. This is our community planner. We are looking to bring that position back. That's another position that was made vacant during the pandemic. Our emergency preparedness, our medical reserve corps, health promotion, and then all of our media and public information comes out of this area. So this is our current strategic plan objectives and strategies. The strategic plan is worked on with our entire staff. We get feedback from them through a series of different activities that we do, and then leadership takes that and synthesizes that to look at what the staff are feeling and what we need to look at. So this, in large part, really did not change a lot. Last year, as we all know, what we did predominantly. So I would draw attention to strategy 3.3. That is actually the only new strategy that we wrote in, which is our COVID-19 response and recovery with action steps. We are really excited to get back to this, to get back to the work that is really the public health work and what we are all in our jobs doing and love to do. So we're excited to get back doing our community work and making strides in that. We're excited our community health needs assessment should be published this fall. So we are anticipating that and some work that can be done. And then really a lot of this work also encompasses our Heartland Healthy Neighborhoods Collaborative, of which we're a part of in a lot of those ways. So again, not a lot of changes to note of on here, still the work that we're committed to, and again, looking forward to getting back to. Want to just draw out a few accomplishments over this past year. So number one is the creation of our infectious disease division. That really was an accomplishment in and of itself. So being able to onboard an entire division during a pandemic, get them up and running, trained to do the work that we needed them to do, and to do the work, that was a feat in and of itself, and they've done it very well. We were able to apply for many COVID grants during this time to help both the work of our health department, but also our community at large. And then I pulled out a few numbers. Our COVID tests, so this number up here, the 1,819 is the test that the health department actually gave when we stood up our testing operations from mid-May through the early part of December. So since then, we pulled some numbers, and so as of June 30th, over 89,000 tests have been given collectively with all of our community partners here in Shawnee County. So a lot of the community work that went on last year is also, and this year is also an accomplishment. Our vaccines, of course, that's keeping us very busy right now. So this number is currently where we have given through June 30th of this year. And so we, of course, started at Ag Hall doing our vaccine clinic there. And since then, we've taken our show on the road and we've done over 100 different mobile vaccine clinics with more requests coming in every day. The last point here I put was working remotely. We talked about that. We felt like that was really an accomplishment. We took staff that have never worked from home and moved people home last year. We had people doing jobs in a different manner than they've ever done before by working virtually and serving clients through telehealth. And really all of our programs were able to continue on in some form or fashion. It may have not been the most conventional way to start with, but the staff really embodied it and jumped on board. We had our immunizations program closed for about 4 months from approximately April to July. But other than that, every other program was able to keep going during the pandemic. So since then, our immunizations department, last July we opened back up to appointments only, and then last month I'm happy to report we opened back up to walk-in clinics. We know that's really the manner in which we serve a lot of people. So during the past year, we were able to serve over 17 eligible children through our immunizations program and department. So even though, again, we were closed a short time, we were still really able to keep up with the work. New positions. I want to talk about just a couple of new positions that we have on our budget for this year. One is a grant writer. This is a position that you probably heard about, I believe, last year. And the thought at the time was we were going to partner with a different department to bring this position together. And since then, leadership has decided that we feel like we have got enough work for a grant writer to be able to do for the health department. So we have collectively been tracking some numbers. And so we know for approximately a little over 3 years that we've passed on over $690,000 in grant money, largely because the folks sitting here in the room with the leadership team and myself are the grant writers for the health department. And so a lot of times, time is of the essence with the grants. And so having the ability to write the grants and the skills to write the grants also, we feel like is really important. And we feel like by bringing somebody on board that would be dedicated to that position would be able to help us research the grants that are available and be able to turn them around in a timely fashion. That would be paid out of our health department budget. The other position you'll see up here is a vaccine coordinator. This position would likely be paid out of our, or not likely, is written into our COVID grants. And so right now, as I mentioned, we've done over 100 mobile vaccine clinics with requests coming in almost daily. So our vaccine coordinator right now is actually housed out of our clinical services division. And we really need to get her back to her clinical services division. As I mentioned, we're onboarding family planning. And so this is a supervisor person that we need to be fully in that work. And so we feel like by bringing this person on, that would be able to take the load off of her and put it over into more of the infectious disease division and be able to coordinate those vaccines. But we're thinking even more broad. It may not be just COVID vaccines. Of course, we're getting ready to embark on flu season also, and that's a great opportunity to do community outreach. The only thing I would mention is it's not new positions, but we of course are working to change our intermittent positions over to part-time permanent positions. So we've got 2 of those that we're currently working on with HR right now. So just to the changes that were needed in those positions. And with that, I'm going to turn it over to the actual budget presentation for slides and money talk to Edith Gaines. And then we'll both be back up for questions.
Good afternoon, Commissioners. Edith Gaines, the Finance Officer with the Health Department. So our 2022 total budget request is $8,114,317. This is an increase in total expenditures from 2021 of $463,354. For the 2022 budget request, the personnel budget represents about 69% of the total health department budget, and the personnel costs for 2022 have increased by $224,922. This includes an increase in FTEs by 4.01 for a total of 81.31 FTEs. And again, for the 6th year, we are not requesting an increase in our tax allocation. That request remains the same as in the past. For our aid to local grant awards, we have this year received an increase of $109,276 in our aid to local grants. This is due in large part to an increase in our state formula grant by $70,431 and our family planning grant of $63,375. And we did see a significant decrease in our chronic disease risk reduction grant by $26,253, which is almost 50% of that funding. And then this is just a comparison over the last 5 years of our aid to local funding. So this year we have received a slight increase of $48,867 in funding from our aid to local grants. And then this is just a recap of all of our grant funding. So this year we have requested $567,427 in grant funding, additional from prior years. And one thing to note about this slide is just for the aid to local grants, there's a difference of $305,170 in our budget request due to what we requested versus what we have actually been awarded for the 2022 year. So our new grants for 2022 are our COVID-19, consisting of various grants in the amount of $774,470 for response and recovery efforts. Okay, and you've seen this slide before. We always like to just give a recap of how the health department's budget fits into the entire county budget. So for 2021, the county budget was $111,879,835. The health department's 2021 tax allocation budget of $2,151,781 represents 1.9% of the county's 2021 budget. So for 2022, our budget request is $8,114,317. That breaks down to approximately 26% tax allocation, 20% program income, and then 54% in grants. And the health department's 2022 total budget is approximately 7.3% of the 2021 county budget. So that concludes my presentation, and we would be happy to answer any questions that you may have for us.
Questions for the health department?
No, not really.
Theresa, can you touch on just the not the reaccreditation, but the accreditation process? Do we anticipate there's going to be any expense outside of the consultant agreement that we signed?
No, I'm looking to Edith. Edith is our accreditation coordinator, but no. So we do have our contract with our consultants, and we don't anticipate any additional cost. We do anticipate bringing our contract forward. We'd like to get an extension through the end of the year to finish that. But right now, what we're essentially doing is going through the document that was provided to us by the Public Health Accreditation Board, known as FAB, and basically all of the documents that were not met to their standard, as we've been working on those by each of the 12 domains, going through them. In some cases, we're able to just add to the current document that we have. In other cases, we've had to go back and to the drawing board and find a completely different document. So we're working through that, and as I said, we initially had our contract ending in September, but felt like we needed the additional time, so we will be bringing that forward to ask for an extension through December.
Any other questions for the health department?
Well, nothing so much related to the budget as just kind of some general questions about the health department and
Sure.
kind of, how you see things progressing moving forward. Obviously, the grant writer, I think, is a good step to try and get some additional funding in the building. But, you mentioned earlier on, we had talked about kind of the infectious disease division and how it's been primarily COVID focused, but you're hoping to transition that into some other things. Could you kind of speak to that a little bit?
Yes, I don't think we have anything necessarily concrete. Derek has and I have met just a couple of times to talk about what some long-term options might be. Derek's really done some due diligence and visited around the state to other health departments that might be similar to ours or might not, that have an infectious disease division and the work that they do. So I think looking at more maybe our clinical services area and the work that they do, they're doing the very hands-on piece of it, but we're not necessarily looking at some of the data behind it or able to look at more of that raw information of where some of these cases are coming from in that regard. So I've got a lot of ideas. I'm sure we'll be bringing those forward with you, but right now we're really still focused on COVID. Unfortunately, we're just not able to move beyond that, but at the same time, we're trying to at least always look beyond that to do some long-term planning.
And then could you speak to, and maybe Derek might be a better person to answer this, but the effort you guys had with the various organizations trying to do the vaccination clinic, I believe, at the Salvation Army, how did that go?
yeah, I'll definitely let Derek take the stand on that one.
All right, thanks for the question, Commissioner. So the clinic we held on the 26th, kind of in partnership with KDHE and a bunch of the other community members. I can't rattle them off at the moment again, but we ended up giving just over 30 doses. They did offer all 3 vaccines on site, and then we had a lot of different community members there. Kansas Children Discovery Center and the library were doing some games and free books. We had some people come out just for that. We also had interpreters on site that really helped. And I've told leadership before in meetings too. We had a couple of really heartwarming stories where people were saying, well, I was just in the area and I've kind of been nervous before. And so we sat down and kind of talked through their concerns and any questions they had. So we had a couple of those cases as well. And then we're actually doing a follow-up clinic on the 17th as well, kind of a time to be determined still. It'll be right around the same 10 to 2 time range, but we're still finalizing that. So we have a second opportunity for that follow-up too. But I think just even more than just the vaccinations given was just kind of being there too, being present and reachable, as I like to call it, and got some good feedback from some of the state partners too. We do have a meeting with all of those members of that vaccine fiesta team, as we called it, this week actually, to kind of debrief, go over what went well, what could have been better, so we can do some of this stuff into the future too, even outside of COVID vaccine.
And then you mentioned there were all of the different vaccines were on site. So are we now to a point where people choose which one they want? And if so, which ones are
Yeah.
they choosing?
So KDHE was the one that really supported the vaccine efforts at this one. Typically, we don't do multi-vaccine clinics. It just offers some logistical issues and introduces always the room for human error. And so we hadn't done that to this point, but we will on the 17th. The vaccine allocation, I guess, came from the state, but I think we are to a point where people can choose, and it's actually out there on the vaccines.gov webpage where you can, click the tile that you want and search for who's offering that kind of in the area. So,
Interesting.
Commissioner Rippon?
What percentage of adults, say over 21, have been vaccinated in Shawnee County? Do we have a number? Or
oh goodness.
Doesn't have to be.
Here, you can pull it up, yeah. I know we vaccinated just north of 75,000 individuals as a whole, as a collaborative.
And is there an age where we don't do we vaccinate people under 18 or under 12, or is there a number there that?
Yeah, I mean, COVID specific, we do 12 and older at the moment with Pfizer. That's the only one there. And so some of the school clinics have been successful with that. The clinic on the 26th, Salvation Army, did several individuals 12 and older, and kind of, I would say, below 21 too. Yeah.
But there's only one vaccination you use for that?
Correct, yeah, just the Pfizer 2-dose.
That's what the FDA approves, or?
That's what's been, approved, I should say authorized at the moment, so.
Authorized?
Correct, yep, and they're looking at, we're very hopeful that the age ranges will open up, again, most likely for the Pfizer vaccine to a younger population, and then the Moderna, they look at the safety information that comes back from the trials. The Moderna vaccine is looking very promising for kind of that teenage age, I guess.
Okay. Any other questions? All right.
Thank you.
Thank you. All right. We will have about a 5-minute break before our next budget presentation.
So, we had looked at it, but there's not really
There is no.
funding source out there at this point in time. We have evaluated that in case there was a survey that went out last year, 2 years ago now. That
All right, it's 1:30, and we're here to hear from Health Access.
Yes, good afternoon. My name is Megan Skaggs. I am the new Executive Director of Health Access. You've probably been used to Carla presenting over the years. She's gone on to be the Director of Community Engagement at Stormont, and I am coming up almost on a year of Health Access. It's been a really great year for me. I'm very excited to be a part of it and looking forward to the future. You do have a handout that I have in front of you. We're going old school today, not having a presentation, so if you have any questions based on that handout at the end, please let me know. Health Access has celebrated our 19th anniversary just this past March, so we'll be coming up on 20 years next year. Since 2002, we have improved access to health care for 16,390 unduplicated low-income residents of Shawnee County who are uninsured. We combine donated physician care, hospital services, dental care, optometry, and medication assistance in a coordinated way, which is led by the Shawnee County Medical Society. We are one of 4 counties in Kansas with this donated charity care program. Sedgwick County, Wyandotte, and Johnson County also follow the Health Access program model, or say we follow their model, you might say. Our goals remain the same. Our goals are to increase access to care for low-income uninsured residents of Shawnee County, promote health equity, and the efficient coordination of physician volunteers. We focus on preventive health, working alongside many arms of the safety net within Shawnee County. All patients enrolled in Health Access must have a primary care, so our focus is to get those patients enrolled in some type of primary care model. Most of our patients, nearly 70%, go to Grace Med. We have about 18% of our patients have a private family care doctor or internal medicine doctor through Cotton O'Neill Clinics, University of Kansas, St. Francis, and some other independent providers within Shawnee County. And then we have an additional about 30% of our patients that have primary care through Vallejo and through the Pine Ridge Family Clinic. Once enrolled, these patients will have access to donated specialty care, dental, optometry, and prescription assistance. What we do at the Health Access office, our small but mighty crew of 3, we recruit physician volunteers and we monitor referrals to spread the charity care equitably throughout all of the physician volunteers. And we also make sure that these physicians only receive the number of patients that they've agreed to care for. Every specialty provider says, I'll take 5 patients this year, I'll take 10, et cetera, and we want to adhere to their donated requests. Currently, we have over 330 providers that have donated their time and efforts to Health Access. Patients are eligible for re-enrollment every 6 months, and what we do is we screen them for income guidelines and we see if there is a potential payer source every 6 months, because if there's a payer source, we definitely want these patients to utilize that. To qualify for Health Access, patients must be reside in Shawnee County. They must have no other insurance or other coverage, and they must be within 150% of the federal poverty guideline. We currently today have 1,621 individual patients enrolled, and we average about 1,600 patients a month. We have recorded over $213 million in donated care over 19 years. We work to assist the working poor. Our patients don't qualify for a state medical card because either they make too much or they don't qualify for the Affordable Care Act benefits because they make too little. Nearly 80% of our patients are under 100% of the federal poverty guidelines. 58% of our patients are female, many of which are single mothers. Our most common zip codes of patients that we assist are 66605 and 07. So through access to preventive care and prescriptions, we are able to keep patients out of the emergency room. We prevent the improper use of emergency care. And our last quarter, we had 91% of our patients surveyed report that they had not been to the emergency room. So our preventive model does work. We also had an additional 89% of patients report that they were able to get well or stay well, so they were able to work. Year to date, Health Access has received nearly 325 emergency referrals. These referrals typically come from the emergency room, from inpatient care, outpatient care, in both of the hospitals, St. Francis and Stormont Vale. Typical referrals for these patients needing emergent care are victims of domestic violence and sex trafficking. They might have emergent dental needs. Diabetic complications. Here in the last year, we've seen a large increase of patients who had a COVID diagnosis. I'll say probably January, February was our highest volume of referrals with that diagnosis, and then since we've tapered off. Also, heart attack, stroke, or cancer are some of the #1 referral means to health access. We have recently received a 2-year grant extension from the Topeka Community Foundation to extend our LINK program. The LINK program stands for Listening to Needs, Identifying Goals, Navigating Your Community, and Keeping You Healthy. This program looks at the social determinants of health, those root causes of why people are not able to get healthy or stay healthy. And our partners in the LINK program include Stormont Vale, Harvesters, Vallejo, and the Washburn School of Nursing. With our grant extension, we were able to hire an additional community support navigator, so we're going to be able to double our efforts with this next 2-year grant. The LINK program serves as a resource to improve county health rankings by looking at the patients. We take a deep dive into those social determinants of health, and we break down some of those organizational barriers that are really difficult for patients to do themselves. We are requesting continued funding from the Shawnee County Commissioners for prescriptions because our physicians believe that prescriptions are critical to the success of our program. Without access to prescriptions, patients are unable to utilize the donated care that is given to them. They're not able to get well or stay well. We typically fund medications for seizures, diabetes, high blood pressure, lots of antibiotics. Those are our top medication needs. We work hard to maximize the funding that we receive from you all. We only prescribe generics. The generics must be under $200 a month, and we have a $1,000 per year limit on the funding that an individual patient can receive. We very rarely run across that with patients, and if we do, then we work directly with their nurses, with their care coordinators or social workers to find other means for medications if they do. We do not cover over-the-counter medications like Nexium or Tylenol, and we also do not cover narcotics. Almost all the pharmacies within Shawnee County work with Health Access, and they do not charge a dispensing fee, and they have agreed to the maximum allowable cost that's negotiated on our behalf by Prescription Network. Our patients have an $8.50 copay for prescriptions, and we also, this past year, are working on increasing patient education for additional resources for low-income cost prescriptions like GoodRx or other prescription savings programs. So that way our patients not only are able to perhaps have a lower copay with some of those programs, it's only $4, but then also our funding is kept for those prescriptions that are really needed. We have a management oversight committee that reviews our prescription utilizations and expenses quarterly. We also have a prescription subcommittee that reviews ways to reduce expenses by breaking down specific drug classes even further to make alterations when viable for patients. Last year in 2020, our claims for prescriptions were nearly 47,000. So we have a lot of patients that need prescriptions and that we serve. Our prescription costs are increasing, so our continued funding is really more important than ever. I want to thank you for the county's ongoing support. Historically, in 2014 and previous years, we received $122,500 annually. In 2015 and 16, we requested less because the additional cost savings that we had, we didn't want to request more than was needed. Since 2019, we have received $110,000 and again are requesting the same level of assistance. We plan to use only $7,500 towards operational expenses, with the remaining $102,500 going directly to fund prescriptions for our patients. The City of Topeka continues to additionally fund our program expenses, our prescription program expenses, with our 2021 funding set at $47,500. We have an annual fundraiser that was called Music Just What the Doctor Ordered. In 2020, clearly we had to cancel that fundraiser. We put everyone in a church and had our physicians perform. Not something we could do in the COVID world. And so we've pivoted this year, and we're actually going to partner with NODO to put on an outdoor event this fall called NODO Live. And so we're very excited about that. We'll see how it goes, if we want to continue with the outdoor festival or go back to our Music Just What the Doctor Ordered. We continue to have good relationships with both Stormont Vale with both hospitals. We are currently utilizing donated office space within Stormont Vale Health, which is a phenomenal support for our system. As a partner in the safety net system in Shawnee County, we work with our patients to explore eligibility in the Affordable Care Act marketplace. We work closely with the navigators at Grace Med, and we have our own community support navigators and link that works with patients to see if there are other resources available so that the funding and the donated care that we receive or coordinate is reserved for those patients who have no other resources. The need for health access continues. We are a community-wide health is a community-wide issue that impacts the ability for patients to stay at work, stay employed, obtain work, take care of property and their family, and be productive citizens so they can shop and pay sales tax to maintain a vibrant community. Prescriptions help keep people out of the emergency room, which when the emergency room is used unnecessarily, it will drive up the overall cost of everyone's health care. Health Access does not receive any federal or state funding. We are a Shawnee County program. Like I said previously, we recorded over $213 million in charity care and assisted 16,390 patients individually. Those patients are not here to thank you, so I am. The last couple pages of your handout are our last quarterly comments that we receive when we review patients, and I'm going to read a couple of them here. Without health access, I will not be able to keep my legs from blood clotting. I'm a low-income worker that needs health access. I still need health access. I can't even begin to thank this program for helping me. It is life-changing. I've only had one seizure in the last 12 months. Thank you for your assistance. Thank you for all your support to the doctors, nurses, and everyone that makes this program possible. There are a number of others on those 2 pages that help explain the benefit and some of those needs for our patients. So with that, if you have any questions, I would love to answer at this time.
Megan, just a couple questions about your funding for income.
Mm-hmm.
You noted $15,000, or almost $15,000 from the Topeka Community Foundation. Has that already been granted, or is that an expectation?
That has already been, we'll receive 2 allotments of that grant. We've received 1, and then we'll receive a smaller one here in July.
Okay, and then you're also anticipating an increase from what the doctor ordered to the NOTO Live.
Actually, that's a decrease from the previous year.
Okay.
So historically, we've budgeted for a $20,000 fundraiser. This year, because of COVID and other things, we're only budgeting $15,000.
I think you got it the other way around. On the annual fundraiser, you have 2021 15.5. For 22, you have 20,000.
Okay, so, sorry. Yep, that's, sometimes I get too forward thinking. Yes, that's correct.
Okay, so, and then that's just an hopeful expectation that it would increase by the 4,500 for that.
Yes, yeah.
Okay. I do note that it is a flat budget request or 0 increase for Shawnee County, and I also note that, most of the money is going to prescription, very little of it to operational cost. And I know that Commissioner Rippon really likes that purple on the presentation page.
I do. It's very nice. I have a question. Are you able to handle all the requests that come in, or do you have to ever turn anybody down, or is it?
The only reason we would turn anyone down is because if they weren't eligible.
Didn't qualify.
Yeah, they didn't qualify. For example, we had, probably 6 or 7 months ago, we had a pediatric patient. We don't have many pediatric patients, but we do have a few, who needed a pediatric cardiologist. We did not have a pediatric cardiologist that donated care to our system. So there actually is one at Stormont Vale, and so I reached out to him, and he said yes, he'll donate his services to that patient. So if there ever is a time where we have a service that isn't needed, we try to do what we can for that patient, reaching out to those physicians specifically.
Do prescriptions also encompass like vision care, like something like
No.
that? No. Okay.
We do partner with Lens Crafters. I don't know if you're familiar with the Lens Crafters One Sight program. And so we're able to refer patients who need eyeglasses. They will receive 1 pair of eyeglasses a year.
Megan, it seems like so the money that we contribute, it just mostly goes to prescriptions, right? But it sounds like your program does far more than that. Just out of curiosity, I know with COVID last year, A lot of providers move to a telehealth situation. Have you guys been doing something like that?
So we support the providers in whatever means they would like to donate their care to patients. So I would say yes, many of those providers over COVID did do that telehealth option for patients. And if they were willing to donate that type of service to our patients, then our patients were benefited from it.
Great. Okay, thank you.
Any other questions?
No, thank you very
All
much.
right, thank you, Megan.
Yeah, thank you.
We've got a quick little break until 2 o'clock.
Nice purple, though, that's a nice shade of purple.
I'm a transplant from, I grew up in Chicago.
Oh, okay.
So I'm just learning these
Well,
diehard
yeah,
allegiances up here.
There's no gray area.
Yeah, there's not, that is for sure.
Yeah,
Thank you.
yeah, because this is our last year.
That's what I
We're
thought.
done. So, yeah.
No, that's okay. That's what I thought it was going to be,
It
but
was just that my formula picks up
Bill, is there anybody back at Vallejo?
What's that? No, we took the whole shop. So, Guidance Center, Breakthrough House, empty today.
Everybody.
They think it's still a 5th of July. I think we're all present in the county.
We got another minute to go.
How's it going? A good holiday? Yeah? But that's fun.
I'll watch from
Work in the
safe.
yard and she.
Do you have a place out there, or you staying?
Yeah, I'm saying that.
Okay.
What used to be a road crowded with
Let me just offer this up. She knows all these cool things. I said, you have a, I'm so confused.
razor,
Like, what is it that you
400, whatever you call those.
Yeah.
Go, Mom.
Yeah.
Like, there's
Yeah.
Dangerous, 16-year-olds driving around like
Huh.
that. Almost become the-
Really?
Just to sit on the porch and watch.
Yeah. Huh. Interesting.
What were you doing on your razor?
If I could afford one, I'd have one, but.
They are good. They're fun. They're quick.
Okay, Bill, why don't we go ahead and, it is almost 2 o'clock. We're going to get started with the budget presentation for mental health, and this will be Vallejo and from Family Service and Guidance, and then Breakthrough House. So, turn it over to you.
Awesome. Commissioners, thank you very much. Thank you for having us. I just want to take a quick minute before I introduce our CEOs just to say thank you, not only for your financial support, but all of your moral support for all the mental health that we have going on in Topeka. Without your guys' support, we wouldn't have the partnership that we honestly have here within Shawnee County. As a display of some of our partnership, there are several there are several CEOs here as well, but also employees and board members. I'd just like to have them introduce themselves real quick. If we could start here for me.
Brenda Mills, Family Service and Guidance Center.
Colin Thomas at Family Service and Guidance Center.
Tracy Keene, Family Service and Guidance Center. Karen Smothers, Family Service and Guidance Center.
Dick Klein, Vallejo Board of Directors.
Stephen Robinson, Executive Director, Breakthrough House.
Kristen O'Brien, Director of Special Education out at Shawnee Heights, and I'm on the board of Family Service and Guidance.
Kim Bates, I'm on the board of Breakthrough House. I'm trying to Rebecca Phillips, I'm on board member of Breakthrough House. Lisa Brown, I'm on the Vallejo board. Linda Oaks, I'm on the Vallejo board.
Awesome, thank you guys. And again, we're just here to show our support for all the members within our community who have mental health that we're trying to work with every single day. And so with that said, I'd like to introduce Bill Persinger, CEO of Vallejo.
Thanks, Josh. Commissioners and staff and taxpayers, thank you. We wouldn't have a highly networked and coordinated and broad and deep continuum of care for adults and children and families in this county if it wasn't for the property tax and other taxpayers in this county. So we just want to say thank you for helping us out since 1967. I know that we all consider you folks our oldest customer, and we'll report to you anytime, be accountable in every way we can. I just want to refer you to the written package. There's a lot to read, but it is 3 organizations, and it does tell the complete story about behavioral health here in our county, at least from the public side. For the Vallejo parts, I might just refer you to page 5. I want to run through there real quickly, and I'm going to try. Somebody back here is going to have to time keep me because I promised not to exceed our 4 minutes. I'm already 30 seconds in. So if I rush through this, any of us I know will stay and stand for questions as long as you have time, or at any time subsequent to today. But let me just emphasize the kind of some of the initiatives and some of the work that Vallejo is doing in 4 or 5 major areas. We report pretty regularly, and I think you all have a good handle in terms of what's going on. But I just want to comment on our 24-hour services. We have a crisis residential center, which handles all kinds of individuals who are having difficulties 24 hours a day, suicidal crises, acute mental illness. Our detox programs open 24 hours a day, partially funded by the city of Topeka, by the way, so we hope that that application goes on through again this year. We think it will. But that detox and the residential, the inpatient alcohol and drug treatment program open 24 hours a day. Both of those programs have been a little bit hamstrung, and with the virus, we're down to one person per room, which really cuts in on income. So the fact that every level of government stepped up last year and helped us out was really a wonderful thing, and helped keep those 24-hour day programs going. I want to talk about the mobile access partnership. Had a couple people say, "Hey, I saw your shower." I think Betty saw it a couple of weeks ago. Said, "I saw your shower trailer going down the road," and I just want to emphasize that is the Vallejo shower trailer. Yes, a mental health center owns a shower trailer. It's kind of odd, kind of unusual when you think about it. When you put it together with everything else going on in the MAP program, the county health department, city of Topeka, the police department's involved. Josh's been on the ground many times helping out with that program. The Vallejo shower trailer. The rescue mission's going to have a meal service trailer, not like, but actual meals prepared for people who are homeless or victims of trafficking, other people on the street. Stormont Vale is going to roll out about like it's a motor home primary care clinic. Brenda serves on their governing board, and it'll deliver primary care on the street to people who are poor, uninsured, otherwise at risk. And then you add in just the capacity of all those organizations to take their services on the road and be mobile, hence MAP, Mobile Access Partnership, is really a pretty incredible thing. And we have not done national research. We can't say that MAP is the only interagency kind of rolling continuum of care program in the country, but I haven't heard of such a thing. I've heard of mobile programs. I know that the programs that the three of us operate, we've got staff on the street, almost literally all the time. But to put all this together and move it from place to place in a true faith-based partnership with government and nonprofits is outstanding. The 7 area churches that participate are, of course, faith-based. The Rescue Mission is a faith-based organization, and Vallejo would be one of the nonprofit partners. The county with the health department, Dr. Locke and others have thrown in with us and been helpful, and also the city. It's really a government, nonprofit, faith-based cooperative program that I think of, if it's not unheard of, it's very unique. And the fact that we have government and other support and other partners for that's just a tremendous thing. And I think you're going to hear a lot of good things about it. It's not just about a meal or a shower or some clothes or health care. It's about engaging people who are otherwise disengaged from our society. Help those folks get into recovery, help them find a place to live, a job, reunite with families, get some health care, get off the street if they can. That will save us all money and gives those individuals a dignity. We encountered one individual who hadn't bathed or been able to clean for 6 months. Another individual for 6 weeks, and the amount of dignity to that is incredible. The story they told to the staff on the ground was just incredible. So I just want to spend a little bit of time on the MAP. I want to talk about our work in criminal justice reform, working with the district court on competency stand trial evaluations and restoration. Serve on a couple of statewide commissions in that area, so Vallejo's trying to do some work in that area. And how am I doing on time? Am I good? Doing pretty good. So I just wanted to kind of touch on those big areas. We're really trying to have an overall mission, overall focus on public safety, especially with our county and our state-based grant dollars and some of the federal dollars that we get. So with that, Commissioners, I'd like to introduce, by way of Brenda Mills, our Chief Executive for the Family Service and Guidance Center, Colin Thomasette. Brenda, you want to say a word or two?
No, I'm saving you from having to listen to every voice. Colin's going to make our remarks.
Colin.
Thank you. Thank you, Bill. Thank you, Brenda. And also would like to note, Tracy and Karen, we have a great executive team at Family Service and Guidance Center. I just came on board last fall. Really have enjoyed working with them so far. But I want to start out by thanking you all, the Commission, for the generous increased base support this past year. In addition, the COVID funds were especially appreciated and, really spoke to the importance our county placed on the need for mental health services during the pandemic. With this support, along with the PPP loans, some federal provider relief funds that we also received, and other supports, we were able to keep all our staff employed Our initial projections said that we would have to lay off 75 employees. That's to be celebrated. And again, we thank you. And all the employees at Family Service and Guidance Center, thank you for that support. We're obviously still feeling the impact from the COVID-19 pandemic. During the height of the pandemic, when everything shut down and children, were doing their education from home, we did see a significant decrease in terms of families seeking the initial appointments for therapy services. However, clients were able to continue with telehealth services and through a combination of those services and in person, depending on the particular need, we were able to meet the needs of the folks that we serve. Interestingly, we saw no drop-off in our medication checkups with our psychiatry department. Just a little nuance that we saw with some of the data that we looked at. We actually saw better appointment compliance using telehealth, as our luck would have it. So we did see a significant increase for crisis services during the pandemic, and that continues now, and I'm going to touch on that in a little bit as well. We're seeing an uptick in the number of children experiencing their first psychiatric crisis as coping mechanisms. The systems that the children relied on have been disrupted, whether that's at school or at home. So as I mentioned, during the early months of the pandemic, we did see that decrease in admissions, but once the children returned to school this spring, as expected, we began to see a big jump in the need for services. In April, we had our highest number of monthly admissions in the last 5 years. The need is there. We attribute this to the adjustment issues of returning to in-person classes for kids after a year of being at home, adjustments to new routines, new rules, new expectations, new structures to adjust to, interacting with people and peers, in person versus the virtual world, and the anxiety about getting sick and what that means. It's kind of hard to articulate to kids sometimes what it can mean to have COVID-19. So we also, at Family Service and Guidance Center, provided services in the community through a FEMA outreach program that focused on response to COVID-19. In response, we also stepped up our educational efforts through the real world parenting conversations and the Ask a Child Therapist service. These help support children and families through the pandemic. If there is a silver lining, which again, big caveat, but we're trying to look for those things. As awful as it is, it provided us an opportunity to learn and try to do business in different ways. And those will continue. Using telehealth as an option is a prime example of that. Zoom is incredibly efficient for meetings, or if you need to hop on with someone and have a visual presentation, they can be very helpful for that. And working from home, we're still doing that where appropriate, and I think that can be a positive recruiting tool. So without the pandemic, I think that we wouldn't have learned these things this quickly. We may have learned them, but certainly not this quickly. In terms of pandemic recovery, we continue to work with our community partners to recover and meet the mental health needs of the young folks in our community. We've already seen the disruption that occurred when children returned to school and expect that to continue this fall. We're preparing our staff for that. We believe that we'll see another big jump once school gets back in session after the summer. Workforce continues to be a huge challenge for every employer. We're no exception. We have no choice but to increase the compensation of our employees and to offer, at least try to offer, as we can, unique hiring and employment options to attract a strong workforce. We're going to need to add a practitioner to our psychiatry team in the next year as well. These are challenging positions to fill due to the shortage and cost, but we're excited. We already have a couple options, so that's actually very positive. And also, in terms of crisis, there's going to be a few things you're going to hear about more. To meet the needs of our community and region, we do plan to increase our capacity for crisis services and add programming for co-occurring mental health and substance use disorder services for teens. This is going to necessitate a larger facility, and we're in the due diligence phase of planning for that. Also, I want to point out that upcoming through a partnership with Department of Children and Families and KDAS, the Kansas Department of Aging and Disability Services at the state level, there will be a new initiative this fall to add mobile crisis services for youth in the area, and that'll be expanded to adults, and I'm sure Bill can touch on that as well. And finally, the biggest news and something that is coming is right around the corner for us, and that's related to CCBHCs. This is the biggest shift in funding and service delivery provision for mental health in the state of Kansas since mental health reform. This will create recently passed legislation, bipartisan legislation, signed into law, created the certified community behavioral clinics. And this is going to happen over a few years. So you might see a few news stories here and there. You might say, why aren't we talking about this more? It's a phased-in approach. We're working with the state, again, through partnership. That's how we operate. So you're going to hear about this more and more over the next couple of years. But these are designed to provide whole person care by integrating physical health along with a comprehensive range of mental health and substance use disorder services to vulnerable individuals, while considering their socioeconomic status, housing situation, and other social determinants of health that can really exacerbate health issues. We really do look forward to having further conversations with the commission about this in particular. And with that, I can wrap up and turn it over to Stephen Robinson with Breakthrough House.
Thank you. I also want to thank the commissioners for your steadfast support of our organizations over the years and the county. And I also want to thank the other two organizations that are here today, because when you think of partnership, I've been in nonprofit for 40 years, and it's some of the best partnerships that I can think of, and really pleased with those outcomes. I just want to highlight a couple of highlights from 2020 that the funding helped us be successful in. In the clubhouse, we had an average 23 clubhouse members in our program per day. That's really strong. Our clubhouse is open from 8 to 4, Monday through Friday. We do have one Wednesday a month where it's a social activity. One of those social activities, I'll give an example, was at the Evergy Plaza. A couple of weeks ago, we had the Country Stampede kickoff, and there was a Wednesday evening. Normally, we would have 3 or 4 clubhouse members that are involved in that, but our social activity, we had an all-time high of 13 clubhouse members, and we had 5 staff. And that was a real change for us, because we're seeing our clubhouse members and our consumers in our overall programs as well wanting to be engaged, as the other gentleman had mentioned, in our community, whether it's something like that or just going to the zoo, which are some of our other programs. So they're being engaged more and participating. We served more than 7,500 breakfast and lunch. Our program does include breakfast and lunch. And Clubhouse is really unique because there's a lot of homeless folks. We have a shower for men and women. So if they're homeless, they can come in and shower and have breakfast, have lunch, but they're also engaged in our programs during the day. This isn't like a drop-in center. We're still trying to be an accredited program, and our last director that was in really did a good job in changing the shift from a drop-in to an accredited program. Part of that accredited program, we're open up TE, or temporary employment. And I'll just give an example. Hanover's. I know that's Bill's favorite place. Cooks, dishwashers, and busboys. And that's where they get employment. And we signed a contract with them. If that clubhouse member doesn't show up, one of us staff get to clean the bathrooms, be a busboy. And that, so that engages staff to make sure that we do everything we can to get that clubhouse member there. And we're doing more and more of those and opening up more and more. One of the last positions that was open at the clubhouse, we just filled it 4 months ago, and that's an employment/education coordinator. And that position alone is creating these things to happen, and our clubhouse members can be involved. There were over 1,000 rides provided for our members. During the day, Monday, Tuesday, Thursday, and Friday at our group home, we pick up the members there because because of about 10 years ago, funding got cut. We didn't have staff, and it's important that staff is involved all times. So what we did was we put in policy, at the time the board did, to make sure that it's not mandatory, we want to make that clear, but it's strongly encouraged that they be involved in the clubhouse activities during the day. On Wednesday, they don't participate because they have group activity and a staff member is at the Carroll House. So that's a real important part of the program. 100% of the residents, and this is our residential program, and this is incredible. How many times do you get 100% batting average? Stayed out of jail or involvement with law enforcement. Theresa, who is our director, does just an outstanding job on that. And we don't just take anybody. We take folks that want to live within the community of a group home. And they participate and they get involved with things, and they're also part of the clubhouses I just mentioned. So that's very, very important. And 100% of the residents stayed away from illegal drugs and that. They're kicked out if they are, and we partner with Vallejo at the clubhouse and the residential. You have to be diagnosed with mental illness. That's something we don't do. We partner with Vallejo. So once that diagnosis is there, that's how they can be a resident or a member. 98% of our residents remain stable and out of mental health facilities. 95%, now we're switching gears to the payee program. I hate to admit this, but that number is going to decrease a little bit. Last Friday, we had to dial 911, and a payee member was arrested and put in jail. Today, a different individual, same thing. I had to call 911. Try to get him in control. We had to dial 911. Why is that? One is we did a lot of research on this. We asked staff. We're meeting about this almost daily. One is the stimulus. When you're in our payee program, you get that $1,400 stimulus. This is what I don't like about it. If they want that $1,400, we have to write that check for $1,400. There's nothing we can do about it. We can encourage them, we can give them materials, look at investing in a good used car, buying some good furniture for your apartment, those kinds of things, but it's up to them. We can't control that. And once that money is out, they're wanting more, and they read in the paper misconceived things about another stimulus, another stimulus. So when they come in the payee program, if they're not getting money like from stimulus or other things, they have anger issues, and they take it out on staff. We're, I think, 3 payee programs in Topeka. We're the ones that have our doors open where we're working with them. How much do you need today? $50 for groceries. We give them their $50 if they have that into their account. The other programs just mail it to them. There isn't that one-on-one where they can talk through situations and things like that. So it makes, for our agency, it's real challenging. What we are looking for this year is to get the funding for a case manager for Breakthrough House in the payee program, because if something is escalated, that case manager is right there in the facility, and we think that that would be a better situation than a staff person trying to confront that situation. I didn't feel like getting a broken nose last Friday, And this person did about $600 damage to our plexiglass window in the frame there, busted it open. So we're very, very concerned and very cautious about that. So I also want to say we have 2 new board members, Kim and Rebecca, with Breakthrough House. When I started 2 years ago, we had 6, and one of my priorities was get those board members up. So what we did was we recruited realtors, a lawyer, business people in the community, so there's more involvement on our board. They've been making very, very tough decisions this year, and really good people, and they have the passion for people with mental illness. This isn't something to take lightly, and they certainly don't. We also have a coach, Tom Stringer, who coached at Topeka and won a couple of state high school championships, and he knows the Topeka community really well, and that really helps on our board to be like that. We also have a lot of diversity on our board. Our golf event this year, I'm going to just talk about that because this is unique. We almost had to cancel again. We didn't know. I was getting a lot of concern that the corporations weren't sending golfers, but they would give us a corporate sponsorship. We had the least amount of golfers, but we raised the most money by double. The biggest event this year was $16,000. The previous high was just a little over $8,000. And I really believe people are really tuned in with people losing their jobs or being laid off when COVID hit, that they really see mental illness from anxiety to depression all the way up to schizophrenia. The community is really listening and hearing what's going on. That's all I have right now, but I do want to, again, thank the commissioners and the county for continuing to support us as we continue to grow and thrive. Thank you.
Thank you.
Commissioners, those are just a couple examples of the great work that's occurring within Shawnee County to help our consumers who live here. I can tell you, as someone just who works the street, what I see daily is the need for mental health services have honestly never been greater, not only for the country, but for our community. With that in mind, I would refer you guys to the very last page of your packet, where we're requesting for the year 2022, the same as 21, a $2 million gift from the county. So with that said, I know we only have a couple minutes left, but I would love to open up the floor to any of our CEOs if you guys have any questions.
Questions? No. Can we talk about, just for a moment, Family Service and Guidance, the teen suicide program? And that was a really big issue 3 years ago that we tackled in taking on and addressing teen suicide and Family Service and Guidance. And last year with COVID in the schools, I know that caused a lot of stress and anxiety on our students, and I'm sure that we'll still see some of that as students transition back to school. Is that still ongoing with Family Service and Guidance, or are we focused in on that?
Yes.
Actually, we actually, great question, Commissioner. I'm actually going to call in a substitute, Karen Smothers, who's an actual expert on these things.
Okay.
Expert's a strong word.
No, that's a great question, and I'm glad you're concerned about it. We are continuing our outreach to youth, and we have groups of youth who represent kind of a cross-section of schools in our area. We are also still supporting 7 Cups, which is kind of a warm line for youth, and we send out information about that. Also equipping youth to have the tools to reach out for help when they know they have a peer that's experiencing thoughts of suicide through youth mental health first aid training. And then, of course, our crisis services are getting calls pretty frequently. We also have therapists embedded in the schools who are, when students were back on site, who are also reaching out as well and working with our partners with school counselors, school psychologists, and our school-based liaisons. So yes, that's still very much a focus. Our staff continue to get trained in that area so that we see that as the highest risk area and obviously a priority in terms of prevention.
Okay, thank you. Other questions, commissioners?
No.
Thank you very much, and we look forward to hearing more from all of you in the future. Thank you. We got a quick little 2-minute break, and then we'll pick up with Tark.
Josh, they got you doing like other duties as assigned now, it seems like. I was like, man, I saw you were in charge of the Stampede stuff in addition to all of the other things that you seem to be doing, so.
Yes, sir.
Good job, man. Everywhere I look, I see your name doing something.
I'm trying. I appreciate it.
Yeah. We're almost there. We're almost there. We got
I asked Linda if she wanted to sit in on some more.
just reminiscing and.
And this is it, so.
Okay, ready? It's just a little after
Well,
2:30, so presentation from Tark.
Thank you. Thank you, Commissioners, for the opportunity to present our request. You should all have received our written submissions. We are requesting level funding again this year for all of our programs. And essentially, we are requesting funding for the same services as we have traditionally requested the funding for. You'll see in TARC's submission that in the past, we had labeled one of our programs, it was assistive technology, and it's combined with children's services. It's still within children's services, but it's now referred to as family support programs because we've combined assistive technology and our PACT staff, social worker, et cetera, to be more of a all-purpose team of folks that provide support to the family support teams, or the family services teams in children's services. Sheltered Living was proposing a new program that would be intended to target more of their adults that are served, who are becoming more aged, and serving them in a slightly different manner. Otherwise, not much has changed, other than we all survived COVID in terms of all three organizations have made it through, and made it through in a pretty good place. I will say honestly that we were fortunate that we were able to stay open. TARC was through the entire duration. So we certainly had fewer person-supported adults coming into day services and also at TARC Industries because of the fact that they were served in residential programs and they were not permitted to come and leave to attend our day services program. But everybody's back. Children's Services are back doing home visits again. Even though we were not able to do home visits during most of the pandemic, we were really, our referrals were down slightly during the pandemic, but they are back up to where they were, and in fact, above where we were by 15% from 2019, pre-pandemic. So I think that we did, I'm sure that there were many families who didn't try to access services during that period of time. Some of that was attributed to the fact that they weren't going to their regular pediatrician appointments, no well checks, and that's where most of our referrals come from for children's services. Can I answer some specific questions you might have about our budgets or services?
I've got a question about your population. Going back to when TARC was really founded in 1954, thereabouts, there were very few services that were like the ones that you provide. Now, there seems to be so many services in the community, different services, and making sure that you're able to tag into each one's little specialty. How has that impacted TARC? Where do you see TARC going in the next 5 to 10 years?
Okay, so there's a couple different things. One is TARC is also the CDDO for all of Shawnee County, and so we work with each affiliate as the CDDO who's offering services. And you're right, many of those services that are offered by a provider who opens their doors, but they say, I only want to serve about 12 people. That's my capacity, right? So where TARC has sort of stayed steady is in terms of either growing, particularly in our in TARC Industries and Employment Services Division over the years, and our day services has sort of held more steady, mostly in recent years, and then TARC Case Management is sort of poised, I believe, to start increasing the number of people being served because many providers are getting out of providing case management services. And despite what MCOs have done in terms of bringing in care coordinators, that's still a real critical need in this community. What we see in the county is often people are falling through the cracks because they don't have good case management services overseeing that. We do believe that one of the changes that we made this year coming out of the pandemic was we sort of merged TARC Industries and Employment Services with our day services program. So we are in two separate locations, but we want there to be a little bit more back and forth between the two programs so that somebody doesn't just have to decide that they want employment services and working in the community or working at TARC Industries versus coming to a day services program, that they might say, I kind of like to do a little bit of both, you know? And because we're trying to now, when we hire staff who feel comfortable working both at the Randolph site, which has traditionally served a much lower functioning group of folks, so non-ambulatory, many are nonverbal, lot required day-to-day or daily supports for toileting and feeding. So there's going to be a little bit more back and forth between the two programs with staff as well as persons supported, and that way sort of expanding what we can offer to each individual who chooses TARC for services.
Questions?
Well, so I'm looking at your revenue sources, and it looks like you get money from a lot of different places.
Yes.
And it looks primarily like Medicaid
Yes.
is the number one funding. But
Right.
you guys provide a lot of services that are not just medical care.
Right.
You know, in a traditional sense of what you would be able to bill Medicaid for. But the state funding is a quarter of what we give, and I'm just surprised that there's not more assistance from the state.
Well, okay, so the Medicaid funding isn't just, it's not traditional Medicaid funding for medical. It's the home and community-based services waiver. So those services, while technically are Medicaid dollars, they do come through the state. They go from CMS at the federal level to the state, and then they're passed on actually to the MCOs now to decide how they are going to be reimbursing providers. So, and then there's additional state dollars that come in. And what those state dollars typically provide for are the administrative costs connected with being a community developmental disability organization. So monitoring and managing sort of for the state, the system of services in place in Shawnee County. So that funding is intended to help us provide that oversight. And then in addition, they pay for us to do an annual assessment called a basis screen every year, so that each person who is in services is reevaluated and reassessed every year to determine whether their level of need has changed. So somebody who's getting older, might not have had any medical conditions, and now suddenly they're needing 24-hour supervision, and so their tier rate changes.
Okay.
But the dollars ultimately for most of our services do come through CMS. There's additional state aid funding that comes into Shawnee County to the CDDO. And that money is used to support individuals primarily who maybe are on the waiting list or who do not qualify for HCBS services. For some of them, they're on a tier 0. So that means that, they might have those needs, but they don't come up on the tier schedule, or they're a tier 5 person, and it really doesn't cover the needs that they have. So we have state aid funding that covers some of those expenses, as well as other kinds of supports that the MCOs either don't provide, can't provide, et cetera, for individuals.
Okay.
Bill?
Yes, I noticed on the expenses side, Greenbush contracted service, is that education? Is that?
Okay, so our Children's Services Program, right, in order for us to draw down funding, the federal funding that comes through the state, that's educational funding, in order for us to be able to draw that down, we have to actually be part of an educational center. And so TARC has we used to be TARC Children's Services, and everybody was a TARC employee, but years ago, we associated with Greenbush Education Center. And so those dollars go back and forth between Greenbush and TARC. So most of our children's services staff are actually employed by Greenbush in order for those additional dollars to be brought in. And Laura has spreadsheets that show the back and forth and the back and forth, and it's only a percentage of each of the children's services staff salaries that is actually covered by the funding that we're able to draw down, and that's why Children's Services is getting funding from so many different sources to actually cover those expenses. So, a physical therapist, for example, might be getting paid $80,000 a year. They aren't drawing nearly that amount of money in. Greenbush isn't, and so TARC is then covering the difference through various sources. Some of it is other state funding, some of it's county funding, some of it's Medicaid funding for billing, because physical therapists can bill for Medicaid.
Other questions?
It's kind of convoluted. pie charts help a lot. Laura, is there anything that you think I've?
No, I mean, I was
Yes.
just to say it's about around half the categorical income is cut on those positions, and there's 30-some those
I see you have a line on here for production income. Is that your like shredding business, basically?
Yes.
Okay.
Shredding and some other, work that we do, printing. And, like, for example, we have a contract right now with Hills where we're, the cans were mislabeled, misweighed, and so they come in and we have to take the old labels off so that the new labels can be put back on. There's all sorts of interesting contracts that come in.
Okay.
Big parts sometimes that weigh a ton, that take up a lot of space.
Does Tart do our shredding, or do we do?
We don't have a shredding.
We do,
We do?
Tark
We do,
does
okay.
some of our,
Okay.
Tark does some of our
Okay.
shredding.
If we don't, we should be. It's hard right now to be in the document destruction business because the price of paper is so low in terms of what we can get reimbursed for. Can't really make money. So if it says production income from document destruction, it might be more like a loss, but we're working on it.
Any other questions?
Winter Wonderland this year looked like
It was a record year.
a big
For
success.
Winter Wonderland.
Yeah.
I think I said, folks were a little nervous in the beginning about it, and I said, it should be the best event in the county because people can't do anything, go anywhere, and this doesn't require you to get out of your car, to be exposed to other people. And we had families that came through, some came through 5, 6 times over the course of the month because their kids were cooped up and like, can't we go back to Winter Wonderland? So it was a great year. I hope that it generated enough enthusiasm again and became more sort of ingrained in folks' traditions that this year we won't see a big decline. But they did a great job. Sherry always does a great job of thinking through things and figuring out ways to reduce the amount of physical contact people would have to have with the volunteers. We reduced the number of volunteers that we had to have out there. But the turnout was fabulous. It really was. And our sponsorships increased as well. So that and our golf tournament did better this year than it has in many years too.
That's great.
Yeah. And again, a lot of that was attributed to the sponsorships. So that was great.
We're good.
Any concerns,
No.
questions, nothing else?
I don't think so.
All right.
All right, thank you very much.
I feel, when I saw the rest of the people here for the other one, I thought, well, maybe we should just, maybe you'd like it if we just started loading the room with folks. We could do testimonials. Thank you all so much.
Thank you.
Thank you.
Got a little break until 3 o'clock.
That's right, yeah. Hunting dog dying, selling your old pickup, and a late inning pitching change in a Royals game. That'll do it. There you go.
You let me know when we're at the bewitching hour.
Yeah.
Close enough.
Yep.
Yep.
All right.
So,
We'll go ahead and begin. This is the budget hearing for CRC as well as for social services as well as elderly. Mary, I'll let you kick it off.
Thank you, Commissioners. Mary Thomas, Community Resources Council. Nice to see you all again. And Audit and Finance. I'm going to take it in order of what I have given you, which is no changes from what you received earlier, so I don't want you to think anything's been edited or slipped in. But the stapled letter is kind of our brief summary of what CRC does for the county, for the constituents of the county, how we spend the contract money that is received for the 2 social programming grant processes that we manage. And this hasn't really changed other than we still do all the things we used to do, but as a result of the pandemic, we do a few additional things. But those are just as the need arose. It will not be long-term. So I want to focus on the spreadsheets and the 2 tranches of money, if you will, because if you're going to get a question out and about at the end of the day when budget's approved, it would be out as a result of this. So looking at the first one, which is the Shawnee County Advocacy Council on Aging, where the lion's share of the money goes, of the line items that are set aside for this process. You can see towards the right side of the spreadsheet, the blue starts with what the 22 funding requests were, 2022, from each agency. You can see their history to the left if you're so inclined. Then the percent of change on what that request was from the previous year, and just like all the other directors for programming in the county, I'm sure they told their people, as I told the agencies that applied for granting, it is a flat budget. Some paid attention, as you can see, some thought they'd take another run at it. I don't know, thought they'd get lucky. The yellow column then is the recommended funding from the voluntary group, the committee that came together, of some that use services, some that are just constituents within the county. All of them are Shawnee County residents, and then the percent of ultimate change based upon the recommendation from the committee. So you can see that last year was just under $670,000 that was awarded. Request came in for $742,000 and change. That was an almost 11% swing up. A committee got busy. They sharpened their pencil. A few agencies took a haircut. They're recommending $691,500, which is a 3.3 increase from last year, which they really sweat that. They were very concerned about that. And I told them that the national COLA was about 4.1 or something, and I thought, if anything, that might work for you all, but that's as far as they could go without feeling like they were endangering some programming. So then a couple of highlights. You can see that there is a history for Catholic Charities, but they did not choose. They closed this program halfway through last year during the pandemic, and they chose not to bring it back yet. But we do carry it because it does reflect the totals of previous years. And then a couple that maybe you might find interesting would be the last at Silver Lake. They are very cautious with their requests. They're very careful with the money they receive, and they never ask for more than they need. But it also, they let us know that they sit on several thousand, probably $50,000 or $60,000 within their budget. And they sort of said, we're going to put this in because we want to make sure we're never forgotten, but it's okay if we don't have any money this year. So and I relay those things to the committee as they work. I answer questions, I guide, I let them make the decisions, but ultimately they decided they would not fund Silver Lake this year as the recommendation. All of this information in front of you has not been released. No one knows this but CRC and the 5 committee members. And it will remain that way till the budget is final, unless you have specific questions for me during this process, or you hear from constituents with specific questions. But so far, this has never leaked out, for whatever that's worth. So that's the recommendation there. That would be any real change from what was last year. And I can tell you those folks will be fine with that and understand that, which doesn't preclude them from making any additional requests the following grant year. Would there be questions on the Advocacy Council on Aging funding recommendation from the committee?
Questions?
No.
All right.
All right, then I'll move on to the non-senior programming or straight social service programming. I always run the senior programming grant process first. I give them about a month. It is published in the Topeka Legal News. Plus, I then, once it is published and I feel like the playing field has been equaled, I then send it out to every agency, the applications itself, because they are revamped every year. I send those out to those that applied, whether they were awarded or not the previous year. I always send them again to make sure if they missed the legal news, particularly with the pandemic, people, they were all over the place, so they had trouble keeping up with what they needed to do in their deadlines. So on the social service side, same process is followed. It runs a month later so that we're not forcing these sometimes one-man band senior programming folks who are trying to do everything plus the grant writing to have to run dual tracks on the county grant, because typically the city grant runs this time, often United Way grant runs this time, and assortment of others. They all go after multiple sites of funding and are awarded generally, most of the time, some city money, some United Way money, and they also receive, for the senior programming, they also receive I'm going to call it a stipend from JAAA, Jayhawk Area on Aging. It's from the senior federal money that they receive for mobility, for the medical miles that they incur. So with all that said, you can see that last year was $190,000 awarded, as was recommended by the committee. We had requests in for $236,000, which was a 24% increase. Now, I don't see some of these folks on a monthly basis like I do the senior programming folks. So sometimes the message gets lost on flat budget. So that's what some of that's about. But again, different committee, let me take that back. There was a couple of crossovers because I like to have some folks that saw the senior side of things, if they're willing and have more time to give, also participate in the social service committee work, so that there's a little bit of crossover, so there's some understanding. Some of these agencies apply for dual programming, very specific, distinct programming, senior and non-senior, and it's all outlined in the application and the attachments that they give. And as last year, I brought the notebooks. They're a good 6 inches thick. It's pretty hefty. I didn't bother to drag them this year. I am happy to supply a copy of any particular agency's full application to anyone that wants to see it if they have questions later or someone starts giving them questions and they want the full report. Happy to provide it, just assume you don't want it at this point. The highlights here are a couple of things. Back to Catholic Charities. They had not applied for non-senior programming, well, at least since 2017. They did apply here. Not exactly sure why, other than I know they are revamping with a new executive director and some different directives coming from their corporate office in Overland Park and the Archdiocese. The committee elected to not fund them because it was for food specific, this program. And when they looked at what the other agencies were doing, so many of them had food programming. And of course, they look at me and they say, why can't you make them all work together? And these guys do food, and these guys do medical miles, and these guys do this. I said, I'd love to. Nobody's interested. They have their corners staked out, and they're not sure they want to give up any of the services. And as I have talked about this over the years with some of the executive directors, just to see if I can get any traction on this, it's always, there are specific constituents that we serve who don't want to go to X or to Acme, or they are comfortable here, we know their file, whatever. That's going to be a hard one to get around, but I think that day is coming because you can do a lot more if you consolidate some of this money. And on the receiving side of that, CRC never closed during the pandemic. Our phones rang constantly trying to figure out who was open, who had money, who had food, and an assortment of questions. And as fast as we knew it, we had it out there. But I feel so bad giving 4 and 5 phone numbers out every time they're looking for rent assistance or utility assistance, and we'll say, we don't know if these guys have money or these guys are out of money. It's this constant call and barrage of ringing to figure out which one's going to be the lottery ticket for them that particular day. I know there's a better system. I haven't quite figured it out yet, but I'm not sure I would get them to go along with it anyway. It will have to come from here to get their attention, quite frankly. Just putting that out there for you to soak on. So otherwise, I don't see any other big differences from last year's funding on the social service side. Unless you do, I'd be happy to explain. I don't. They did come up with some funding for First Tee, which I was pleased to see that, because a couple of them just kept saying we don't need to pay for kids to play golf, but that is a whole different situation here. This is a full-rounded program with 8 characteristic principles that the kids go through the game of golf to learn all of that, independence and their ability, maturity and decision-making and honesty and all of those things that kind of the Scouts put together, but this is put together in a different program so that they reach the kids who wouldn't see a golf course otherwise. And they reach out and work with the 501 elementary schools and start there within the education, within the phys ed programming, working with those teachers. I've seen a lot of scholarships come through as a result of that program when Community Action started it several years ago, that for kids that wouldn't have gone to college otherwise. So it's an opportunity when you're not that star athlete and you're not, first chair, first trumpet in the band, where you're not going to get looked at, but you've got a little bit of talent or something that would help you find your talent. This seems to be one of those programs. So we threw a little money at them, and I was glad we did.
I have a question on Topeka Youth Project jobs for young adults. It looks like you awarded more than they requested.
They did. One of the committee members, let me just say, became more acquainted with that program. They had the same executive director for 30 years that, let's just say the program got stale. New executive director, new blood on that board, program completely revamped, and doing the things that it was built to do originally with new energy. And one committee member was quite aware of that and did a good sales job, because there was a little bit of money that they wanted to move around, and they decided that's where they wanted it to go. Doesn't mean it sticks. I'm just saying that's the recommendation. You all will tell me.
But the program could adapt and use that.
Oh, absolutely. They heard me when I said flat budget.
And again, just to make sure that we're clear, we make an allocation to Community Resource Center for their oversight. We make an allocation to the elderly, and then we make an allocation to social services. And then the Social Services Committee comes back with the recommendations, and then the Aging Committee comes back with their recommendations. And our approval of those recommendations are on a separate agenda item.
Correct. Yeah, there's 3 line items in the budget, and these committees work independent of each other. I mean, they were 6 weeks apart, and as I said, 2 members were on each committee, but I didn't feel like that was an influence that wasn't appropriate, because sometimes knowing what they're doing on the senior side when they present on the social service side is helpful.
But I just want to make sure that it's clear that we're not making an approval of a specific amount to a specific agency for social services. That would be part of a separate commission item.
Right. What has happened in the past when I present all of this, whatever comes back within the budget on the line item, if it's a decrease, I pull the committee back together and say somebody needs a haircut, and often they will come back together. Well, I shouldn't put it like that, but I'm comfortable. Sorry, But, I mean, that's the gist of it. And so they will sometimes work at it, or on occasion, I have said, okay, we've got a 2% decrease, and I will, any one of those that was awarded more money than what they were awarded the year before, I will apply that decrease to see if we get there. And generally we do, and I submit that and to the committee to consider, and almost always they'll take that solution because they have really sharpened their pencil hard by the time I get to you with their recommendation. They have their favorites, just like anybody would, but if the 5 seem to work well.
Back to that jobs for
Mm-hmm.
young adults. What do they do exactly?
They have, it's a several-week course that in fact, it's meeting right now in one of our media rooms all day. It's look like about 12 to 15 youth, and they are kind of taking what skills they've picked up from school. They're still in school, but this is getting them out into the working world. They have already prepared placements within companies in Topeka that one of their job recruiter lines up, and then it's working them through the skills that maybe they picked up at school, but maybe they didn't. And then it's the dress for success, and it's the bio or the resume, and it's the mock interviewing, and it's all that process to try and the first time out get that success so that they will continue on that working path.
Karen, Commissioner Mays?
I am actually a graduate of that Jobs for Young Adult program. When I was in high school, my parents sent me to that. And I, at the time wasn't real excited to go, but I think they've helped me find my first job also. And so they helped me fill out applications I was 15 at the time, so we had to find a place that would hire 15-year-olds. They knew all the places that would do that. They had several managers from local companies that came in and would do job interviews with all of us.
Mm-hmm.
So I remember I interviewed with the general manager at Best Buy, which I thought was pretty cool at the time. But it's a good program, and honestly, right now we've got a workforce shortage, and the way to fill that is probably with young people. I think there's a lot of high school kids that don't get jobs at all now. And so, those are the people we need in the workforce now. So at least for those, entry-level type jobs.
Thank you, Commissioner Mays. It's very helpful. You have completely described the program with a couple of add-ons. They are working which is what the committee member brought to the table. They're working on figuring out how to get them from home to job. Because the buses, sometimes yes, sometimes no, if they're doing shift work. So they're adding that component in to make sure that if they land the job, they can get to the job and not be when they're 15 and not driving yet. So that's the piece that was missing, and that's what they felt a little extra money might help with.
That's it.
All right.
That's it on that?
Yep.
Let me just take a couple more minutes. I pulled together some quick little statistics. So it's this one here that's still got our letterhead, the logo, whatever. And it just sort of compares, side by side, if you will, the senior programming and the social service programming, who asks for what the program actually is, so that you don't have to sit there with the spreadsheet side by side. We've put it here in one page for you so that you can see it, if you're curious. Because what I like to make sure that you are aware of is the unduplicated count, the unduplicated head count that your award, the county money, is reaching every year on who they serve. That, I always thought that was a big deal. And then the last item, because we've just come through a census round, which, Kansas did pretty good on the report, kind of compares some of those senior numbers from 2010 to 2020. A couple of those, the ones below where it's living below poverty and living low and so on, we haven't been able to physically pull that yet from the new census data, but we will, and I'll update this as we have it. The one I find, the statistic I find the saddest is we went from 36.2% of grandparents raising grandchildren in the home back in 2010, and now it's 49.3% of grandparents raising grandchildren. Assortment of reasons why, which is nothing we can solve here today, but it's a sad statistic. That's, as far as the senior programming and the Advocacy Council on Aging, this is a lot of what we do for the agencies. I always make sure, because we meet every month, that there is programming and training and education, since they have to be there, although they all come willingly. I want to make sure they get something out of it besides a couple of good donuts and a hot cup of coffee. But they're missing that because we're still doing Zoom. We were going to be in person tomorrow, finally, but I was watching the Shawnee County Health Agency, we all do, and the numbers with the variant and everybody traveling over 4th of July, I thought, don't know what they're bringing back for us to share. Let's give it one more month. And because they serve the most vulnerable population besides infants, the seniors. That's
Questions?
what we're up to at CRC, other than you probably heard that we did partner again with 501 on a new building. Finally have signed that master lease. That took 6 months to fuss over, but finally have a lease with 501 for 10 years at Lundgren, which is in the heart of the Oakland community. I have over 30,000 square feet to fill in the middle of a pandemic. Yeehaw! But I have 4 tenants already and a beautiful gym, 7,000 square feet, beautiful wood floors, pull-out wood bleachers, beautiful stage.
But are you going to continue to do the work at High Crest?
Yep,
So this
CRC
is-
will be firmly there, but will also be implanted in the Oakland community. They've been asking us to get there since 2016.
Okay,
Finally just took a brick and mortar opportunity to make it happen.
great. Commissioner Rippon, any questions?
No, good.
Betty, anything? All right. Thank you very
Gentlemen,
much.
please know, CRC is always at your disposal. We are your legal research arm when you can't reach your counselor or it's something that you need to take out of house. Please don't hesitate to let me know how I can serve you.
Will do. Thank you.
Thank you very much. Enjoy the rest of your day.
Got
Is I'm the
about-
last one, right?
Nope, one more.
Sorry.
No, you're good. Now,
I mean, I want to see him sing Family Tradition and
Yeah.
the Monday Night Football song, but
after that,
all the other songs I'm
now, Blair over at TPAC will tell you that the best seat in the house acoustically is at the back on the, would be stage right side, so it's on the east side.
Mhm.
Right, so stage left, so that'd be over on the east side. It's like near the back. There's one
Okay.
corner. He goes, that's the best acoustic spot in the whole house.
The sweet spot.
That's the sweet spot.
And that place has great acoustics. It really does.
It is that time for Helping Hands presentation. Take it away.
Hi, thank you for having me. I'm Kathy Maxwell. I am the director of Helping Hands Humane Society, and I appreciate coming here once again to try to continue our relationship with the county for 2022. As a reminder, just to kind of reiterate the services that the shelter provides to the county, the more important things are, of course, we take in all animals regardless of behavior and medical condition from the county. Of course, if you leave animals left out, the roaming can cause a nuisance or health issues. Certain diseases are zoonotic and can spread to people, things like rabies as well. Something more common like ringworm we can get as well from animals. So we take all those animals. We also take anything, should the county have any animals that are deemed dangerous and need to have that situation fixed or determined, we are happy to take those animals as well. So moving forward into 2022, the shelter's asking for an increase of $10,000 from $130,000 to $140,000. The reason for this is the cost of the care of the animals have gone up since that figure was, I believe, many years ago originally kind of established. The cost of care per day for the animals is at a minimum of $13.50. And this cost of care includes things like water and lighting and food, and cost of the person to provide the daily care, person to provide the mittens, the chemical that we use to clean, prevent the spread of disease, which also prevents the spread of COVID. This fee also includes there's an additional fee, so $13.50 per day. And then we have a medical package required of all animals coming in. And this medical package is extremely important. Not only does it protect that animal, but it protects the rest of the animals, and even equally as importantly, it protects the staff. This medical package includes a health exam by the vet, your basic vaccinations, a dewormer, flea treatment, and of course a heartworm test or the FIV-FELV test for cats. So this medical package all animals get when coming in is the cost of $87. So if you're looking at the 3-day care totaling $40.50, that medical package of $87, we come to $127.50 per animal. If we project the county's intake based on this year's rate that's coming in, as well as the 3 previous years before, I'm projecting an intake for you guys of 2022 of 1,100 animals. So 1,100 animals times the $127.50 comes out to $140,250. Important to note, this fee does not include things like a rabies vaccination. If necessary, euthanasia, drug, and disposal of the animal. It does not include fees for behavior assessments that determine the risk and safety of the animal. And I believe most importantly, this fee does not include surgeries and other medical treatments needed immediately by animals that are coming in. There is a certain percentage of the animals that will come in from the county that will need surgery or some form of treatment immediately, either to save its life or make it comfortable till that 72-hour period passes. Right now, the shelter is covering all costs on those fees, those kind of emergency type of fees. And so that is my presentation for you right now. Questions?
Helping Hands asked for the $10,000 increase last year, and may have asked for it the year before as well. I know that it's been, I believe, 2 or 3 years that we've not increased. how many animals did we take in last year?
So last year, the county brought in about 1,047 during
Okay.
COVID. The year before was 1,271. In 2018, it was 1,400.
Okay. Right now, we are paying on a contract with
Mhm.
Helping Hands as opposed to a per animal fee.
Yes.
Okay. Commissioner Rippon?
Do you have any funding from the city as well?
The city, yeah, we have a city contract with all animals that come in from the city.
These are ones just from the county?
County.
Yeah.
Okay.
And they don't include any non-cat, dog,
Yeah.
small animals. Those other animals, whether
Mhm.
they're cattle or horses or goats, those are taken care of separately by the sheriff.
Yeah. We can't take hoofed livestock.
Okay.
Okay. Commissioner Mays?
So, the numbers that you gave, the total of, the cost of care, basically,
Mhm.
that's the same numbers that you use to figure what the city's allocation would be and things like that
Mhm.
as well?
Yeah.
Okay.
What does it cost to adopt an animal there? Does that cover these fees or come close to it, or?
No, I mean, even the adoption fees don't cover the cost of actually the animal, because once the animal comes to the property of the shelter, we then invest for the spaying and neutering and the whole medical side as well as the whole behavior side. So the cost of adopting it, if you go right now to adopt an animal, you're going to get a really good deal. They're half off right now, but your dogs, generally $75 to $250. If we have certain animals that we consider high-profile pets, meaning they're like little small breed puppies that tons of people are going to want, we may price them a little higher simply because their fee will help cover the cost of the animals that are really long-term residents. Or should I have a dog that needs a leg amputated, or right now we have a little kitten that needs a leg amputation. So that extra fee will help cover that cost as well. And of course, your cats are anywhere from 25 to 100, but right now everybody's half off. So I encourage adoption. I encourage adoption always, but you can get a deal, so, yeah.
In 2017, we went up to 130,000,
Okay.
and it stayed there since.
I knew that it had been several years. So.
Yeah.
Can you give me the cost of per care of animal again when you did your breakdown? On
Yeah.
average, what'd you wind up with?
Would you like a copy of the form or just?
No, just in general. I mean,
Okay. So the cost of care per day is a minimum of $13.50.
okay,
And then the medical package is a minimum of $87. That's just the basic stuff
okay.
that come
So-
in. So it's $127.50 for the initial day.
Okay,
Or excuse me, it's $40.50 for that 3-day period, plus the 87 medical.
okay. And that's where you get to the 127?
Mm-hmm. Yeah.
And how many animals did we take in last year?
Well, that was 1,047. Do keep in mind that that was the COVID year, the city's intake. Our whole intake was way down last year. It shot up this year. So
Okay, and then, so that's 133,492, just running that.
Mhm.
So Helping Hands, without taking into account that if they were there longer or the cost of adoption,
Mhm.
you're operating at or below profit right now.
Oh, yeah. Yeah, we do on all the animals all the time, yeah.
Okay.
We aren't, our adoption fees or anything, they're not making us the money back.
Just trying to put that in perspective.
Yeah.
Okay.
But adoptions were way up during COVID, right? I mean, that's what I heard nationwide, because people were staying at home, so they.
They say that our adoption rate, if you look at it percentage-wise, even if the number's up, the percentage was still the same. It runs still the same as it's like running this year and the year before. It's around 56% of all animals leaving the building are adopted.
Okay.
We just weren't taking in as many.
I see.
So, yeah, for us, that's where the difference lied.
Questions? All right. Well, thank you very much.
Thank you guys very much.